Hello and welcome everyone to the latest City St George's European Social Survey and NatSen Survey Methods webinar. I'm Tim Hanson, a Senior Research Fellow at European Social Survey Headquarters, and I'll be chairing today's session. We're very pleased to welcome Véronique Siegler and Dan Finch from the Office for National Statistics, the ONS in the UK. Véronique has 18 years experience as a government social researcher at the ONS and manages a team dedicated to enhancing the efficiency and quality of data collection with a strong focus on inclusivity and trust. Dan is currently the head of marketing and social media at the ONS, and he led the marketing campaign for the Census 2021 in the UK. Véronique and Dan will be presenting today on understanding and addressing trust barriers in social surveys, drawing on lots of work that the ONS have done in this area. They'll talk for about 45 minutes, and after that there'll be time for questions. If you do have any questions, please type these into the Q&A area, and we'll go through as many as we can. So now over to Véronique to start.
Hi, thank you, Tim. And as you say, we are really excited to share today an overview of our ongoing work to understand and address the trust barrier in social survey here at the Office for National Statistics, or ONS. For those who may not know, the Office for National Statistics is the UK National Statistical Institute. And the work we're going to talk about today is a key step in continuing to strengthen engagement with our social survey respondents, ensure their needs are met so that we can continue to collect high quality representative data that truly reflect the population. So I will start with a bit of important background to set the scene. Trust is a complex concept studied across many fields, and as a result, it doesn't have a single agreed definition. So for this work, in the context of social survey, we've adopted the internationally recognized OECD definition, which says that trust is a person's belief that another person or institution will act consistently with their expectation or positive behavior. This definition is underpinned by three types of trust. There is the interpersonal or generalized trust, or trust in strangers. In the context of surveys, that the individuals who represent the survey process and interact with respondents, in particular field staff. There is the institutional trust, which is a trust in an organization competence and intention. In the context of social survey, that will be the organization collecting the data and conducting the survey. And then there is limited trust, trust in people personally known to the individual, which has still some relevance in the context of social survey, as community-based approaches could be used to leverage trusted intermediaries such as local community leaders to improve participation. So why trust matters? I'm sure I don't need to explain to the audience today that the decline in response rate for social survey is a major concern and challenge for many countries, certainly here in the UK, and it has significant implications for data quality, including increased risk of non-response bias and reduced representativeness. In this context, in 2020, the UK National Statistician established the Inclusivity Data Task Force with the goal of making a step change in inclusivity of UK data and evidence. One of the key recommendations of the IDTF is to create an environment of trust and trustworthiness, which allows and encourages everyone to be counted in UK data and evidence. Trust is definitely the foundation of participation in social survey, as without it, respondents are unlikely to engage, but Of course, even when trust exists, participation still depends on other factors such as motivation, ability to take part, and so on. Importantly, trust is not static. It is a dynamic process. It evolves through repeated interaction at every survey touchpoint. Each contact with respondent is an opportunity to build, reinforced, or if mishandled, undermine trust. So we did not do a comprehensive literature review, but we looked at some past research which shows that interpersonal trust is shaped by cognitive and affective factors, where cognitive factors involve thought-based evaluation, while affective factors relate to the emotion and personality traits that shape how we relate to others. When judging how trustworthy a stranger is, people often rely on quick shortcuts such as responses to facial features, stereotype, etc., alongside perception of competence, integrity, and benevolence. That is, whether the other person has good intention and is acting in our best interest. In social survey, this means that respondents will react differently to interviews, and not everything can be controlled. However, training interviewer in communication skill to convey trustworthiness is really important. And external elements such as survey material and communication can support interviewers by reinforcing legitimacy and organizational trust. Institutional trust is also shaped by many factors. Citizens assess institutions based on their competence, such as their responsiveness, their reliability, and values like openness, integrity, and fairness. But trust in institutions is not determined by performance alone. It is also influenced by individual attitude, perception, and feeling, as well as cultural context. Norms of reciprocity and norms of civic duty can shape how trust is extended to institutions. Broader political and economic conditions also play a role. And finally, institutions have a reputation much like brands. An effective communication strategy can strengthen or weaken legitimacy and trust. So this slide highlights the research project we reviewed to better understand the nature of trust barrier in social survey participation. There was the call center analysis project where we examine why respondents contact our organization, the ONS, what are their concerns and motivation. We looked at the respondent burden project, which involved in-depth interview with participants, refusers and attriters, those who dropped out of our survey, longitudinal survey, to explore their perception of survey burden. We looked at our inclusivity review, where through internal engagement and cross-government consultation, we identified key barriers to participation for different groups. We also reviewed an inclusivity study, which consisted of 4 projects with neurodivergent individuals, visually impaired participants, deaf and hard of hearing individuals, and those with common mental health condition, to assess how survey materials support or hinder participation. We looked at the interviewer insights, which were focus groups and semi-structured interview with the interviewing community, and which provided valuable perspective on challenge and trust-building strategy used by interviewers. We looked at the tenure attrition project, which consisted of focus group with renters and homeowners to understand how tenure influences attrition. And finally, we reviewed pop-up testing, which were real-world pop-up sessions in the community all across the UK with underrepresented group. And that allow us to engage directly with these groups, exploring their perception of trust and others' barriers to participation. So our research indicates that one of the biggest barriers to trust is the lack of the awareness in our organization, especially according to interviewers in the field. Even when there is awareness of the ONS, knowledge of what the ONS actually does is often vague. For example, people may know ONS produces statistics, but not that it collects data to inform policy. The quote from a member of the public on the slide sums this up perfectly. I definitely knew who the ONS were, but I was not aware you could get called up for a survey. This gap in knowledge about the fact that ONS runs surveys to collect data fuels doubt about authenticity of survey and increases fears of scam, especially as contacts are unsolicited. A second major barrier to trust, as shown by our research, is uncertainty about why the data is collected, how it will be used, and whether it will make a real difference to people. Concerns about how the information might be used by government, fears of surveillance remain really strong, particularly amongst groups who feel marginalized or disconnected from decision-making processes. Feelings of disillusionment also play a role. Some people doubt their participation will lead to change, as you can see from the quote on this slide. Yet, when the survey topics feel meaningful and relevant, motivation to participation rises. People are more likely to participate when they really understand the survey's purpose and see its relevance to their life. For some groups, such as people with disability, emphasizing inclusion and explaining how their input leads to tangible outcome is especially important. Trust is also influenced by concern about data handling and protection. Our research shows that people need and want reassurance about how their information is stored, anonymized, safeguarded, but people are particularly worried about the risk of data breach. And high-profile data breaches and media coverage amplifies this public mistrust, making it really hard to build confidence, even when strong protection already exists. Concerns are especially strong among vulnerable individuals, where breaches could have serious consequences. For example, if someone from the past could discover their address. The fourth barrier is related to the survey process. On this slide, you can see an example of the survey process, where at first contact, respondents receive an advance letter and a need-to-know leaflet with all the essential information about the survey. Next, they are contacted by a field interviewer and provided with additional material. A face-to-face interview is arranged, and upon completion, they receive an e-voucher or paper voucher as a thank you. Our research indicates that trust is shaped by the experience of the entire survey process, through interaction with the interviewer, the design and accessibility of material, the incentives, the modes of contact used. This shows that strengthening trust required a really consistent and inclusive, transparent approach across all the different stages of the respondent journey, from first contact to follow-up. Every element must work together to meet the need of each individual at each touch point. In summary, our research shows that the trust-related barriers across the respondent journey cluster around 4 key questions: very much underpinning the ONS competence and value, which are critical for both interpersonal and institutional trust, as described in earlier slides. First, who the ONS is. Many respondents are unfamiliar with that, which can lead to fears about personal safety and concern about scams. Second, what we do and why. People often question the purpose of data collection and worry about how the information will be used, particularly by government, and whether it will be genuinely benefiting society. Third, how we handle data. Respondents express concern about the handling of sensitive personal information and the risk of data breaches. And finally, issues with the survey process or perception of it, such as delay or poor communication, can further weaken or increase trust. To explore solutions of how to overcome this trust-related barrier, we organized an ideation workshop, not to define or implement intervention in detail, but to identify opportunity to strengthen material, processes, interviewer training and communication, or to consider new approach. In terms of our approach to this workshop, firstly, we mapped what we are already doing to overcome this trust barrier against the respondent journey. So for this, we review all the different touch points, the letter sent to respondents, the training interviewer received to build trust, the information on the website. The workshop was guided by behavioral science principle and using the COM-B model to map barrier and identify behavioral drivers. For those who don't know, behavioral insight is an approach that uses evidence from psychology, behavioral science, and economic to understand how people make decisions. In the context of social survey, behavioral insight can help us understand how people make decisions about taking part and design communication and surveys that lead to higher engagement. There is a link on the slide where people can find out more information about COM-B model if they wish. We brought together a very diverse group of participants, field interviewer with first-hand experience, communication and marketing specialists, survey operations staff, researcher, all in one room. This mix was essential to avoid a single perspective shaping the approach and to encourage innovative thinking. We ensure that their thinking was framed using the EASE framework. Again, there is a link on the slide for those wanting to find out more information about this. Here is an example to explain how we reviewed our material. We give already information about the survey, its purpose. We say that the information we collect helps inform decision, which influence national and local policy, or that the answers of the respondent will help shape the future of the UK. But is this too vague? In one of the leaflets, we say that we use information to produce economic statistics such as measuring of inflation. But is this a message that people relate to enough? I want to emphasize that all our material have already been developed through extensive research to meet the respondent needs. However, they have not been previously reviewed through a trust framework lens, nor by such a diverse group of people with different specialisms. This provided a valuable opportunity to build on the strong work already in place and take it further with fresh, innovative thinking. So as I said, we mapped against the COM-B model. I'm not going to go into too much detail into this, but just in summary, the COM-B model is used in behavioral insight because it gives a structural framework, breaking behavior down to three aspects. The C in COM-B stands for capability aspect. Do people have the skill, the ability to participate? O stands for opportunity aspect. Do they have a chance, the physical and psychological opportunity to participate. This means practical things like clear invitation letter, but also whether the environment make it feel normal or expected to take part. For example, if others in their community have done it before. And finally, the M in COMBI stands for the motivation aspect. Why would they want to take part? What would motivate them? The idea is that by understanding whether a barrier is caused by a capability gap, an opportunity gap, or a motivation gap, it's easier to design a targeted intervention that directly addresses the reason why people do or don't behave in a certain way. To give you an example, for barrier 1, limited awareness of the organization reflects a capability gap, not having the knowledge required to participate, an opportunity gap, if the way material are presented affects whether a respondent can easily verify survey authenticity, and motivation gap, if this low familiarity leads to mistrust and reduced willingness to participate. To develop ideas to overcome the identified barrier to social participation, we use the E framework used in behavioral insight. That is, to encourage a behavior, we should make it easy, attractive, social, and timely. Easy because people can be put off doing something when it appears complicated. So it's important for any process to be simple and for the message to be simple and clear. Attractive is about capturing people's attention with message tapping into their emotion, the use of image, and making the action more appealing, often with rewards or incentive. Social is about leveraging social network, as humans are social beings influenced by what those around them do and say. And timely, because people react very differently to the same information depending on when they receive it. People value the present more than the future, and getting them to commit can really help them follow through their intention. So, in summary, we reviewed research projects to unpack the trust barrier. We organized a workshop based on behavioral insights. Many ideas and insights were generated during the workshop, and the priority intervention selected was something innovative that we've never done before, which is a pilot marketing campaign aimed at increasing engagement and response rate in social survey. This was very much a co-production from my team and that of my colleague Dan Finch, who will now take you through the development of this pilot marketing campaign in Birmingham.
Thanks, Veronique. So first off, when we developed the campaign, we used the OASIS planning format. This approach is recommended by the Government Communication Service. We find this a very useful method of breaking down the different areas of marketing campaign to develop the right approach. And the following slides broadly follow this format. Next slide, please. So the pilot communication campaign design. For the trial, we focused on targeting Birmingham local authority area because the response rate of below 35%, it had a higher index of multiple deprivation and a higher volume of cases compared to other local authorities. We decided to target all surveys taking place in the area during that time. These were mainly labour and financial surveys, and to target all 762 invited households during the period of the campaign. This provided a greater number of households, but it was mainly the transformed labour force survey that sent out the vast majority of invitations during this campaign. Adverts and messaging designed to appeal to underrepresented groups using messaging and imagery that resonated, but focusing on specific ethnicities or groups would have reduced our numbers to a very small amount, so we didn't focus on those specifically for this campaign. Next slide, please. As Veronique has already outlined, the campaign focused on overcoming 4 key trust barriers, which was, I don't know I don't know who the ONS is or who runs the ONS surveys. I'm worried that the survey could be a scam. I'm unsure if my data remain confidential, and it's not clear why my contribution is important. Next slide, please. When it came to our objectives, we focused on increasing engagement and to change views when it came to key areas of trust. Overcoming these trust barriers will more likely lead to increased participation. And so these objectives were to test the concept that targeted communications using postcode data could help increase survey engagement through addressing the trust barriers. I won't read those out again. Next slide, please. So when it came to one of the first steps of the campaign was to develop our campaign proposition. By this, I mean the design, look and feel, along with the copy and written strap lines and messaging. We did all of this in-house in conjunction with our in-house design team, the marketing team and the survey team. So we focus on bringing together ONS branding with a clear strapline and messages, demonstrating the impact of survey completions, which is a known barrier to participation. Our three teams undertook a creative exercise to produce multiple creative ideas, and these were shortlisted to 2. We tested these with via quantitative analysis with just over 1,000 individuals. So the 2 concepts we tested were it starts with you and make yourself heard, and I'll show you these in the next couple of slides. Both tested really well, but it starts with you had the best overall response rates. We then amended the copy and the designs based on some of the outcomes and feedback from the research. Next slide, please. So here you can see it starts with you, which was the ideas we used, although these are the ones we put forward for testing. So the final versions are slightly different to this, but these are the 3 ideas that we tested. And then in the next slide, you can see the make yourself heard option. So broadly, they are quite similar, but where it differed was in around the messaging and in the strapline and the actual copy that we used. Next slide, please. If we go into some of the details around the quantitative analysis, there were some clear learnings that we took on board. So just to kind of reiterate, the test of the proposed messaging, imagery and straplines through an online survey with a nationally representative sample of just over 1,000 people from England, Scotland and Wales, and we had an additional 113 participants from Asian ethnic background to ensure we had a diverse representation. Some of the feedback was around message clarity is crucial. Purpose of the survey must be immediately understandable and relevant to people's everyday lives, and call to action should be prominent and easy to interpret and to avoid assumptions of prior survey knowledge. Visual design really matters, but things like color preferences vary widely. So choose inclusive and broadly appealing palettes, and also to use inclusive and relatable imagery. Next slide, please. So to continue that feedback, trust influences engagement. People with a low baseline trust in ONS remain less likely to engage. Messaging should be used to build confidence, transparency and legitimacy. For example, prominently feature the ONS name and logo. Quick fixes are generally not possible. Repetition is also essential because consistent exposure to the same messaging over time reinforces credibility and builds familiarity and trust. Also, future considerations, we should explore things like digital formats for younger audiences, such as video link materials, interactive adverts, and social media content. But also look at to explore audience-specific adaptation, so further refining materials and engagement strategies, so further testing, and to work with expert advisors such as marketing experts in engaging with hard to reach audiences. Next slide, please. So when we look at the strategy, we had a challenge, And that was, we needed to develop something that overcame several kind of key areas. We needed to overcome the fact that we only needed to engage with 762 households out of a total of 423,000 or so in the Birmingham area, so it was a tiny amount. So we needed to choose the right channels, the right marketing channels that allowed us to target directly with households with minimum advertising spill or wastage. We also need to develop a strategy that addressed a complex set of barriers. And in addition, within Birmingham, there was quite a mix of ethnicities and different languages. Finally, we had a limited budget and a short period of time to deliver. So what did we do? Next slide, please. So when we decided to review our media channel choice, we reviewed all of the paid media options that were available to us at the time. And we wanted to focus on channels that allowed us to use the full postcode to target only. Most advertising channels use the district code, which is the first part of the postcode to target. So whereas when you can use the full postcode, you might target hundreds of households. With the district postcode, you may target thousands of households. So we ruled out multiple channels that use that approach. So that included things like social media advertising and digital advertising, as it would have meant would have been a huge spill outside of the targeting. So that left us with only 3 choices, in fact. So that was direct mail. So that was using broadcast video on demand. So that's where you have the ability to place a TV advert on popular on-demand channels, which is things like ITVX, Channel 4 and Sky, and then out-of-home adverts. So that's things like billboards and bus stop advertising. Next slide, please. When it came to the tactics and the campaign phases, we opted for a 3-phased approach, which was prime, prompt, and remind. So prime is where we developed an A5 postcard delivered to all targeted households 2 weeks before the invitation letter arrives, priming them that the letter is on its way. And I've got examples of all these 3 in the next few slides. Prompt was the broadcast video on demand TV advert. There's a 30-second advert, which we targeted to households in the postcode area only to encourage the households to open the letter and to participate. And then finally, remind, which was our digital out-of-home billboards, for example, on bus stops, were displayed to remind households to take part. This was all underpinned by a campaign landing pages, and in each of the 3 phases we encourage people to go to the website to find out more information if they wanted to. Next slide, please. So first off is the postcard. This is a postcard that was sent to all 752 households. The primary message on the front was focused on making households aware the letter was coming. We made sure we added an image of the invitation letter envelope on the front and back, and landed key messages around impact. In this case, taking part will help us understand the cost of living and impact decisions like mortgage rates and rent prices. We tried to ensure these messages were widely understood and relatable to all audiences. It's really important to note that this content took a lot of effort to get signed off internally. We had lots of discussion with our legal department and others around using the right language to explain the ONS's role is in impacting decisions on mortgage rates and rent prices. Also adding in a line about local areas. So for example, here, Birmingham, look out for your invitation letter in the post. Plus we added a QR code where you could scan and it'll take you to the landing page. Next slide, please. So here we have the TV advert, which is a 30-second advert, which we developed in-house, and we can play that advert now for you. So yeah, as I said, we produced that all in-house, and we used a combination of paid for actors and a staff member, plus a professional voiceover. And we added in picture again of the envelope, and continued with the messaging around cost of living and mortgage rates. Next slide, please. This is the digital out of home. We focus more on the reminder messaging, encouraging the completion of the survey. Again, we added in the area name to personalize it somewhat. A digital version had moving graphics, and adverts were placed within a 1 kilometre of the postcode areas. And this covered around about 60% of the Birmingham area. Next slide, please. With this chart shows the campaign was implemented across the operational phases of the survey collection period. You can see how the 3 campaign phases started and ended around key operational periods, such as when the invitation letter went out and when the fieldwork started, and it was around about a 7-week campaign in total. Next slide. So when it came to our campaign evaluation, we didn't have the time or the budget to run a big gold standard study like a randomized control trial to assess impact. Instead, we used something called a contribution analysis. In simple terms, this means we're looking at the evidence to see how much our campaign played a part in the outcome, alongside other factors that may have also influenced things. It's a bit like being a detective and not having a clear fingerprint or a DNA sample that proves the marketing campaign was the cause, but you gather circumstantial evidence that strongly suggests it played an important role. On the slide, you've got a more of a formal definition of the contribution analysis, which I won't read out. We also had a process evaluation to understand whether respondents could be targeted effectively and to learn from the delivery of the campaign, as it had never been run before, and the operational complexity of running such a campaign should not be underestimated. Next slide. We focused on 3 main questions listed on the left-hand side. Did the campaign activities reach the intended audience? Did they help address trust barriers? And did they contribute to a greater participation in social surveys? To explore this, we used a mix of methods listed on the right-hand side. For example, we looked at engagement metrics. We gathered interviewer feedback through focus group. We compared survey return rates with the earlier periods, and with Manchester, the comparison area. We need to stress that there were operational constraints. For example, interviewers used a structured questionnaire on the doorstep, but the questionnaires may not have reached those who are actually exposed to the campaign. We also did an online follow-up evaluation survey, but only a small number, a small share of respondents agreed to be recontacted. And of those, only just over half completed the survey. So this limits how reliable and representative the findings could be. Next slide, please. So here we have some return rate figures for the transformed labour force survey, which was the main survey that took place in Birmingham during the time of the campaign. Return rates rose by 5.4%. compared with the previous 7 weeks, and 6.3% when compared with the same period last year. And we did not see any change in Manchester, which is the control area we used. The increase came mainly from easy to reach households, which were up 13.6% compared to the previous 7 weeks and 21% compared to a year ago. But importantly, we didn't see any gain among those hard-to-reach groups who received a knock-to-nudge visit. In terms of the same composition, we also saw a significant increase in the proportion of 65-plus respondents compared to the previous 7 weeks. Knock-to-nudge is where interviewers knock on people's doors to encourage them to participate in online surveys. Currently, specifically to encourage hard-to-reach audience to participate. So unfortunately, we didn't see any increase in return for hard-to-reach groups. while the campaign may have improved participation for easier to reach groups, but this was not a gold standard method. We cannot say so with certainty. Next slide, please. So if we look at some of the evaluation metrics from the paid for media, the postcard was delivered to all 762 households successfully. The billboards reached 60% of the target audience, which is roughly about 500,000 people. So that's the entire population of Birmingham. And the advert was seen 1.4 million times in the 762 postcode areas only, with nearly 1,300 clicks to the landing page website. From the field interviewer focus groups, we also had some positive feedback and also areas where we need to address for future campaigns. So the postcard played a helpful role in building awareness of the ONS and increasing engagement from respondents, and interviewers reported increased engagement and willingness to participate among respondents who had received the postcard. However, some interviewers felt campaign materials lack clear information about the ONS, and there was mixed feedback on the impact on reassurance about survey legitimacy. So this is something that we can take away and we'll address for future campaigns. Next slide, please. On this slide, you can see a few statistics from the evaluation surveys. As I mentioned earlier, the results should be interpreted with caution. So about 44% of respondents recalled the postcard, compared with 4% who remembered the billboard. But important to note that recall of advertising is often underestimated in marketing. People may not consciously remember what they've seen or heard, even though it can still influence their attitude or behaviour. Amongst those who did recall the postcard and TV advert, just over half said it reassured them about the survey's legitimacy. Between 41 and 55% said it helped them understand the importance of being counted and raised their awareness of the ONS, and slightly lowered and a slightly lower percentage of between 37 and 45% said the TV advert also increased their motivation to take part. So with, next slide please, when it comes just a flag around research limitations, as listed on this slide, I'm going to go through a few of those. As I previously said, we're not able to use a gold standard evaluation method, mainly because of constraints around time and budget. The campaign itself only ran for around about a month, again, because of limited resources. This means we're not able to capture any longer term effects that might come from repeated exposure over time. On top of that, we could not isolate the impact of individual materials or channels, and external events such as Ramadan, Eid celebrations, and also bin strikes that were taking place in Birmingham during the same period of the campaign may also have affected participation. Finally, we can't be completely sure whether it was the trust building elements or simply things like receiving extra mail that made the difference. These are all important caveats to bear in mind when interpreting the results. Next slide, please. So in conclusion, based on the evidence available, we can say that the intervention, particularly the postcard, may have helped to raise awareness about the ONS, reassure people that the ONS surveys are genuine, increased understanding of the importance of participation, and for some even boost motivation to take part. The return rates for the transformed labour force survey were higher during the campaign, possibly as a result of it, but we can't be certain. Unfortunately, the increases was not among the underrepresented groups or harder to reach the groups. They mainly came from those groups who are 65 plus. So that kind of meant that the campaign was largely brought in more of the same respondents. Next slide. So that's the last slide. Thank you for your attention. And do you have any questions?
Great, thank you, Veronique and Dan. That was a fantastic presentation and lots of interest there, I'm sure, for everyone here and for me as well. And thanks to all the attendees for making it a really great session. And we hope to see you again at another one of the Methods seminars. Thank you.
Thank you. Bye.
Cheers. Bye.